Hello, the field of surgery is one of the most popular specialty choices amongst many doctors around the world. And in this video, I'm going to answer the question, how hard or how competitive is it to become a surgeon in Australia? Hi there, I'm Dr. Anthony Llewellyn here to help you with all the best advice and information about the medical careers process right here in Australia. Now, I have a bunch of resources to help other doctors in their career process. And for anyone watching this video who's thinking of applying for surgical training in Australia, I do have some free training that will specifically help you with the interview process. Link in the description below. So we're here to answer the question, how hard or how competitive is surgery in Australia? And I'm not going to hold you in any more suspense here. I can tell you that if you're currently thinking about a career in surgery, let's say you are just about to finish high school in Australia, then you have less than a 1 in 100 chance of becoming a surgeon. So to explain that, I'm going to quickly cover a few points here. One, the reasons why you might want to become a surgeon in Australia. Two, what the statistics tell us about how hard the process is, including how I come up with my 1 in 100 statistic. And three, finally, some things you may want to consider that may impose some barriers if you're thinking about embarking on a surgical career. In a future video, I hope to go into more depth about the process, including the 9 subspecialties of surgery. But if you're wanting more information after watching this video, I will link to a blog post that I have done on the topic, which does give you additional info, particularly on the process and those 9 subspecialties. But for now, let's dive in. So why become a surgeon? Well, there's no doubt that becoming a surgeon can be truly a rewarding part of medicine. Learning how to operate successfully on the human body requires great skill and intellect and can often lead to immediate improvements for your patients. And of course, at times can literally be life-saving. There's also a lot of prestige that comes with being a surgeon, and surgeons are often the innovators in health. Surgery is always changing and improving over time, whether that just be refining and improving on an existing operation or designing a completely new and safer way to operate. Surgeons can even operate now remotely on patients by using the internet and robotic technology. Another reason you may want to become a surgeon is that surgeons do derive the biggest incomes out of all medical practitioners traditionally. In fact, according to the Australian Tax Office, surgeons as an occupational group regularly top the list of income earners in Australia, earning on average around $394,000 Australian taxable income per year, beating out all other medical professional groups such as anaesthetists, physicians and psychiatrists like me, as well as all other occupations, including financial dealers, judges, and even CEO. So how hard is it to become a surgeon in Australia? Well, to answer this question, I'm primarily going to look at what you have to do as a doctor to be able to train as a surgeon. Now, obviously, it goes without saying that training as a surgeon is also difficult. There are often a lot of hours required to perform clinical work, a requirement to log a certain amount of successful operations, a knowledge and learning of skills component, and of course there are examinations that you must pass to complete your fellowship of the Royal Australasian College of Surgeons. But first you have to actually get into training. Getting into training in itself is not easy, and there are a lot of prerequisites that you must fulfill in order to simply apply to train as a surgeon in Australia. The first of which is that you must be a doctor. So in order to train as a surgeon, you need to complete a medical degree. Now, depending on which source you are looking at, gaining entry into a medical school course in Australia is either the most difficult or one of the most difficult courses to get into. According to one particular research article I found looking at applicant and acceptance rates for 3 established medical schools in Australia, only 5% of the applicants in any one year received an offer of a place in a medical school program. And of course, you must then accept that offer and complete your degree, which not all medical students do. Now, assuming you have graduated from medical school, you still can't simply go into surgical training. Unlike some other countries in the world where you can apply for specialty training in medical school or at the end of medical school, in Australia there is a provisional period of generalised training which you must complete called the internship. So you need to complete your internship, which will make you eligible to gain what's called general registration as a doctor in Australia. Technically, at this stage, you may in fact be eligible to apply for selection into surgical training, because an essential requirement to apply for training, in fact for any college in Australia, is general registration. However, there are a number of other essential requirements that will likely mean that you have to wait at least another year or two. It is at this point we should introduce you to the Royal Australasian College of Surgeons. The Royal Australasian College of Surgeons, or RACS as it is often friendly known as, is the specialty medical college in Australia and New Zealand that oversees both qualified surgeons and surgical training. RACS itself is made up of a number of specialty training groups, which are also represented by a society. So applications for surgical training in Australia and New Zealand are generally conducted both by RACS as well as the respective society. There are 9 recognised surgical specialties in Australia, which are each represented by a society. These are general surgery, orthopaedics, urology, cardiothoracic surgery, neurosurgery, otolaryngology and head and neck surgery, sometimes referred to as ear, nose and throat, plastic and reconstructive surgery, vascular surgery, and paediatric surgery. Most of these specialties are covered by one society across Australia and New Zealand, but a few, such as orthopaedics, have separate societies between the two countries. Surgical training is referred to as SET training, and SET stands for Surgical Education Training. And you can apply once a year for SET training in any of the above listed specialties, and you can apply for more than one if you like. Now, there are certain general requirements you have to meet in order to apply, as well as requirements which are specific to each specialty. So for the general requirements, the first one we've already mentioned. You must have your general registration. So this is one of the reasons why international medical graduates can't just apply for surgical training in society. They also have to go through the process of obtaining general registration before they're allowed to apply for any particular training scheme, whether it be with the College of Surgeons or another one. Now, the second requirement with RACS is that you must be either an Australian citizen or permanent resident. So this is going to preclude you if you are on a visa and, say, an international student who's done the medical degree in Australia, or an IMG doctor who's gone through the recognition process. In addition to these prerequisites, you also need to complete a couple of RACS online training modules for things like hand hygiene, as well as operating with respect, which is a program to teach trainees about well-being and anti-bullying programs run by RACS. Finally, you must also have sat the RACS General Surgical Science Examination, the GSSE, which is an exam covering anatomy, pathology, and physiology as it relates to surgical practice. Got it so far? Well, then there are the specific requirements for each SET training program. Now, these generally comprise you having to obtain a certain amount of experience in certain surgical areas, as well as some competencies and some basic procedures. Now, I'm not going to go through all 9 specialties in this video. As I said, I've actually done a more extended article about this on my website. But as an example, in order to just apply for cardiothoracics training, on top of all those general requirements I mentioned, you will need to have had at least 2 surgical terms of 20 weeks total in any surgical specialty in the last 6 years, plus a minimum 10 weeks specific rotation in cardiothoracic surgery, as well as be able to demonstrate competency for the procedural skills of inserting a chest drain and harvesting a long saphenous vein and harvesting a radial artery. So now that you've established your eligibility to apply, what are your actual chances? Again, I'm not going to go through the specific details of the application process in this video for every specialty. I will hopefully do that in a later video, and as I said, there's more information on the related blog post. But generally speaking, the application and selection process for SET training involves a few things. Firstly, you have to submit an application form with a CV or career profile, and then this is rated and ranked by the college. You also have to submit a number of referees who are contacted, and the results of these referee checks are also rated and ranked. Now, your application score and referee score will normally be used to determine whether you progress to the interview round. The interview phase generally has the highest weight of the 3 components and either solely determines the outcome or is combined with your application and referee scores for the final score. Application numbers and numbers of posts vary considerably across the specialties. For example, in 2020, there were 323 applicants for general surgical training, with 108 offered a post to commence training in 2021 in Australia, versus there were no interviews offered for cardiothoracics in 2020. And the next smallest program was paediatric surgery, with 21 applicants and 3 offers in 2020 for the 2021 training program. Overall, for the year 2020, which is the most recent data available on the RACS website, there were 894 applicants, translating into 244 successful offers across the 9 SET training programs. That's about a 27% or 1 in 4 chance. The Neurosurgical Society of Australasia helpfully provides 6 years of data of selection outcomes. Now, across 6 years, there were 340 applicants for neurosurgical training for 63 appointments, which is a 1 in 5 ratio. So putting these figures together, you can see how I was able to estimate that if you are currently in high school in Australia and were considering a future career as a surgeon, you have a roughly 1 in 100 chance statistically. Now, you have to bear in mind that that doesn't necessarily take into account that you can apply more than once. So your chances probably do improve a little bit more than that. Now, other things to bear in mind. Obviously, a range of factors will affect your prospects of a surgical career. And there are certainly a lot of things that you can do to boost your prospects of A, getting into medical school, and B, getting into surgical training. Some of these things that you can do require more time, and they include things like gaining what's called unaccredited experience in surgical terms, as well as undertaking research or high degree programs relevant to surgery. And this is why most prospective set trainees will generally wait only until they feel they have maximized the number of points that they can get on their application score and accumulated a good and large set of referees before applying for training. And there's a reason for that. You see, you don't want to apply when you know that other doctors are just going to outrank you on their application score alone. And prospective set trainees will also generally wait a few years to apply because it costs money to apply. The current cost for registering to apply for set training is $595 Australian. And you also have to pass the GSSE exam, which currently costs $4,145 Australian. Now, on top of this, each set program generally charges somewhere between $800 to $900 Australian for the application process. Now, finally, another reason folks defer applying is that for most set training programs, there is actually a maximum number of times that you can apply. This is generally either 3 or 4 times. So again, it's no point applying if you know that you're not going to get in that year. Finally, another thing to consider is that because the process is so competitive, most applicants will dedicate a considerable amount of time and perhaps also spend money on preparing for the interviews by practicing interview questions and employing an interview coach like myself. So there you have it. Becoming a surgeon in Australia is a highly competitive process. Remember, if you're thinking of appearing for set interviews, then I do have some free training for you available via my website, link in the description below. I will also leave some links in the description to my coaching programs if you're considering getting some help. Please subscribe, like, share, and everything else, and I will see you in another video.